Vitamin C by Jacob, Maddie, and Chandler.
In this presentation, we will go over what vitamin C is, the functions, food sources, deficiencies, toxicity, treatments, the history, symptoms, vitamin C and health, RDA, collagen production, and cancer prevention.
What is vitamin C? Also known as ascorbic acid, is a water-soluble vitamin, which means that carried to the body's tissues but are not stored in the body. Due to vitamin C being water-soluble, it does not stay in the body very long. It needs to be eaten every day. Unlike most animal and plants, vitamin C is an essential nutrient. Nutrient required for normal functioning that cannot be synthesized by the body.
Functions of vitamin C. Vitamin C is an antioxidant, which is a compound that inhibits oxidation. It is needed for collagen synthesis, which is vital for skin health. It makes other essential compounds, and it enhances the absorption of iron from plant foods.
Other functions of vitamin C. Vitamin C is required for the biosynthesis of collagen, carnitine, and neurotransmitters. Collagen is essential components for connective tissue, which plays a vital role in wound healing. Vitamin C plays an important role in immune function and improves the absorption of non-heme iron. Ongoing research is examining whether vitamin C, by limiting the damaging effects of free radicals through its antioxidant activity, might help prevent or delay the development of certain cancers, cardiovascular disease, and other diseases in which oxidative stress plays a causal role.
Food sources. Red peppers, half a cup, 95 milligrams per serving. Orange juice, 3/4 cup, 93 milligrams per serving. Orange, 1 medium, 70 milligrams per serving. Grapefruit, 3/4 cup, 70 milligrams per serving. Other sources. Broccoli, Brussels sprouts, cauliflower. Turnip greens, sweet white potatoes, tomatoes and tomato juice, winter squash. Other good sources are paprika, liver, and oysters. Fresh raw fruits and vegetables offer the best supply.
Deficiency in vitamin C is called scurvy. It is a clinical syndrome and it makes the mouth feel very bad, and the gums are detached from the teeth, blood runs from the nostrils, ulceration on the legs, and some of these heal, but the skin is thinned. The disease was first reported in 1550 BC. During this time, people diagnosed and treated using onions and vegetables. It is characterized by fatigue or lassitude, widespread connective tissue weakness, and capillary fragility. It can be fatal if left untreated.
Toxicity. While vitamin C is an essential nutrient, it's possible to have too much of it. Vitamin C has a low toxicity and is not believed to cause serious effects at high intakes. The most complaints are diarrhea, nausea, or abdominal pain, heartburn, headache, or kidney stones.
Symptoms. Within 8 to 12 weeks, loss of appetite, weight loss, fatigue, irritability, lethargy. Within 1 to 3 months, there can be signs of anemia, malaise, or pain, including bone pain, swelling or edema, petechiae, or small red spots resulting from bleeding under the skin, corkscrew hairs, gum disease and loss of teeth, poor wound healing, shortness of breath, mood changes, and depression.
Treatment and management. The endpoint of replacement is 1 month or upon resolution of clinical sequelae. Alternative treatment regimens for adults include 1 to 2 grams for up to 3 days, followed by 500 milligrams daily for a week, followed by 100 milligrams daily for up to 3 months. Administering vitamin C supplements are by mouth or by injections.
Those who are more at risk. Smokers. Studies consistently show that smokers have lower plasma and leukocyte vitamin C levels than non-smokers, due in part to increased oxidative stress. For this reason, the IOM concluded that smokers need 35 milligrams more vitamin C per day than non-smokers. Exposure to secondhand smoke also decreases vitamin C levels. Although the IOM was unable to establish a specific vitamin C requirement for non-smokers who are regularly exposed to secondhand smoke, these individuals should ensure that they meet the RDA for vitamin C. Alcohol abusers, low-income people, people with limited food variety, people with malabsorption issues. Some medical conditions can reduce the absorption of vitamin C and/or increase the amount needed by the body. People with severe intestinal malabsorption or cachexia and some cancer patients might be at increased risk of vitamin C inadequacy. Low vitamin C concentrations can also occur in patients with end-stage renal disease or chronic hemodialysis.
Vitamin C and health. Due to its function as an antioxidant and its role in immune function, vitamin C has been promoted as a means to help prevent and/or treat numerous health conditions. This focuses on 4 diseases and disorders in which vitamin C might play a role: cancer, including prevention and treatment, cardiovascular disease, age-related macular degeneration, AMD, and cataracts, and the common cold. A lack of vitamin C can also affect the immune system, absorption of iron, and metabolism of cholesterol.
Immunity and history of vitamin C. American scientists and Nobel Prize-winning Linus Pauling claimed in the 1970s that vitamin C could treat and/or prevent the common cold. More vitamin C can support the immune system. After some studies were done, scientists came to the conclusion that by taking vitamin C, it would not prevent colds, but it would shorten them by up to 10%. Vitamin C can slightly reduce the duration of the illness in healthy people, but will not affect its incidence and severity.
RDA and prevention. 90 milligrams a day for men, 75 milligrams a day for women, 85 milligrams a day for pregnant women, 120 milligrams a day for breastfeeding, and more than 35 milligrams a day for cigarette smokers compared to non-smokers. Can be prevented by consuming vitamin C, preferably in the diet, but in the supplements as well.
Recommended dosage and improvements: 1 to 2 grams per day for 2 to 3 days, 500 milligrams for the next 7 days, 100 milligrams for 1 to 3 months. Within 24 hours, they can see an improvement in fatigue, lethargy, pain, anorexia, and confusion. Within 1 to 2 weeks, they can see resolvement in bruising, bleeding, and weakness. After 3 months, a full recovery is possible. Long-term effects are unlikely, except in the case of severe dental damage.
Collagen production. Vitamin C interacts with amino acids with collagen cells to provide hydrogen and oxygen so those amino acids can make collagen. Without optimal vitamin C levels, collagen production slows down, making your skin more susceptible to wrinkles and bruises. Collagen is an abundant structural protein, comprising of about 1/3 of the total protein in humans.
Interactions with medications. Chemotherapy and radiation, safety and efficiency of vitamin C during cancer treatment is controversial. Some data indicate that antioxidants might protect tumor cells from the action of radiation therapy and chemotherapeutic agent. Other data suggest that antioxidants might protect normal tissues from chemotherapy and radiation-induced damage. Due to the physiologically tight control of vitamin C, it is unclear whether oral vitamin C supplements could alter vitamin C concentrations enough to produce the suggested effects.
Cancer prevention. Higher consumption of fruits and vegetables is associated with lower risk of cancer due to high vitamin C content. Vitamin C can limit the formation of carcinogens, which can lead to cancer. Vitamin C supplementation with other micronutrients does not affect cancer risk. The evidence is consistent on whether dietary vitamin C intake affects cancer risk. Results from most clinical trials suggest that modest vitamin C supplementation alone or with other nutrients offers no benefit in the prevention of cancer.